This is John Robio's case with polycystic kidney disease. This is by Wilson Tabzon, and
Jacky Yap.
polycystic kidney disease is an autosomal dominant gene. A single gene is enough to be causing this disease, and it's located within one of the non-sexed chromosomes. The affected gene creates a protein that allows the kidneys to grow properly and organize themselves through a signaling system they form. Um, Also, since this disease affects the non-sexed chromosome for 16 or 4, and if it's recessive, 6, the abnormal proteins cause the signaling system to break down and the kidneys no longer grow properly, forming cysts.
So for this pedigree, you can see that John is affected by disease with an autosomal dominant D and a recessive D, and his wife is not affected and has two recessive D genes. And all these four children are the possible different outcomes um of if the child will have the disease or not. So two out of the four children will have the disease because two of them have the autosomal dominant gene and two of them will not have the disease. So overall, the chances of passing the gene down is 50%.
Is there anything we can do about it? There is no cure for the disease, unfortunately, but you can slow it down through lots of water and no caffeine. You could also relieve the pain through painkillers or relieving your blood pressure. Also, once kidney failure starts, you could either do dialysis or wait for a kidney transplant from a willing donor. When will the symptoms of the disease take into effect? It starts to be in effect during your teenage or early adult years. And is there any important symptoms we should be aware of? Yes, the disease causes high blood pressure, organ failure, brain aneurysms, and heart disease.
So John's wife is pregnant right now, and there's a 50% chance that the child would have PKD. And some recommendations for John's family include blood pressure management, which is um, which is necessary because in PKD, a common complication is hypertension, which is basically high blood pressure, and BP control is important for the child and John in order to keep their blood pressure in check. Another really insisted recommendation is a kidney transplant for John because if he does not get his kidney transplant, then there's a possibility that he will go into kidney failure. Another recommendation is a low sodium diet, preferably lower than 2,000 milligrams a day. Another recommendation is a fetal screening, which allows the doctors to diagnose their child early. And another recommendation is newborn screening, which basically scans the child in order to see the condition is popping up early in order to provide the necessary treatment. This is polycystic kidney disease, and thank you for watching.